It's not just radio, it's Rockland World Radio. RocklandWorldRadio.com.
Welcome to Creating Health, Mind, Body, and Spirit, heard on Rockland World Radio, 8 p.m. Eastern Standard Time every Wednesday evening. Well, this Wednesday evening, the first day of spring, 2013. You can go to davisahs.com to find out more about the Advanced Health System. And now, the host of Creating Health, Mind, Body, and Spirit, Dr. Ken Davis. But before I bring on Dr. Davis, I will remind you to click on the chat room button to join us in the chat room for your questions and comments. And now, the host of Creating Health, Mind, Body, and Spirit, Dr. Ken Davis.
Okay, everyone, welcome. Dr. Ken Davis. This is Creating Health, Mind, Body, and Spirit. It is March 20th, right? As Rich said, the first day of spring. And I'm excited to be back. I have not been on we haven't had the show for a bit as we are reorchestrating a lot of our programming. We're going to have an exciting year ahead. Tonight's show is going to be a presentation and a demonstration actually on the system or approach that I've been teaching out in Seattle, Washington and Vancouver, Washington, called 3 Days with the Master. These are 3 one-day classes that we have actually successfully completed our first graduating class a little bit ago, and this weekend I'm going to be coming out and teaching our 2-day program, an advanced class called Thinking Like the Master. So tonight is an opportunity for all that's tuning in and everyone tuning in to be able to view and look at this very dynamic assessment system, rapid assessment system that we've been teaching, and practitioners who are absolutely excited about it have implemented into their practice. And we'll get into this in depth and explain a little bit to you more about how you can have the opportunity to use these tools and assessment tools in whatever techniques or current procedures that you're utilizing in your office. Again, it's a very, very rapid assessment. It's a dynamic process that can help you to really determine very rapidly what's going on with your patients and your clients. So this system is really open and available for all licensed healthcare practitioners. We'll talk about that in a little bit. So also, as Rich said, that you have an opportunity tonight to chat with us and ask questions in the chat room. Also, Rich, the phone line is also open tonight, so you can call in tonight and ask me any questions that you may have. That number, Rich, again?
Yes.
Hang on.
Of course, that number is 845 353 2910.
Let's give them to
That's
him one more
845 353 2910.
Okay, cool. Let me tell you a little bit about myself. Again, my name is Dr. Ken Davis. I'm a practicing chiropractor in Ridgewood, New Jersey for the last 37 years. And have practiced and studied the more advanced approaches in the chiropractic profession, as well as studying and learning many, many other alternative healing techniques that have included Chinese herbology and homeopathy and acupuncture and clinical nutrition. In my chiropractic profession, I am a certified soft tissue orthopedics instructor by the late Dr. M.L. Reese, and I'm also a certified SOT instructor by the late Dr. M.B. DeJarnette, and was mentored by Dr. George Goodhart and have over 400 hours in applied kinesiology. And I'm a craniopath, and I do many, many other things that have put together a system of approach that really takes all these techniques and procedures into consideration in a way in which we can, again, put it together and, again, be able to rapidly assess what's going on in our patients. Well, again, later on in the show, we'll go a little deeper into this. My mentor, Dr. M.L. Reese, was a pioneer in the chiropractic profession and was a principal researcher and developer in the sacral occipital technique organization. He was a very close associate and friend of Dr. M.B. Desjardins, as I mentioned, who founded sacral occipital technique, who himself was also an osteopath, and his teacher and instructor was William Garner Sutherland, and so he was an osteopath as well. Back in the early 60s, Dr. Reese was given a research project by Dr. Desjardins, who had started to investigate the ability of the side plate bones of the skull, or the temporal bones, to be an indicator that can determine what's going on with the vital organs and systems of the body. But he handed that research project off to Reese, and Reese, in his genius as a researcher and also having this incredible background in electronics, he took the ball and he ran with it. And I'd just like to read you something from, before I do that, let me just mention this also. Being involved with Dr. Reese for many years and kind of being, you could say that I was one of his major disciples that followed his work and still do to this day. I was blessed and granted by his son Mike Reese and his daughter Deborah Reese, I was gifted with his archives of research from over 50 years that we have been cataloging and putting together in a library that will be available for practitioners around the world to have access to. Again, we'll mention that at the end of how to access that for those that may be listening and are interested in that. One of the projects, or this project that he was given by Dr. Desjardins, was the ability to continue on in his investigation of the temporal bones being an indicator for how we can look at the side plate bones of the skull and tie it into how it affects, how it relates to the spine and how it relates to vital organ, gland, and tissue function. I'd like to read you something from his original book on TS work. What we're going to discuss tonight and demonstrate, as I will with Kristen, my assistant associate, is what's called temporal sphenoidal diagnosis. And in the 3 days with the master's program, you as the practitioner will have the ability to be able to learn the system and again rapidly assess and evaluate and use these assessment tools to really in a matter of minutes be able to determine the vital imbalance and problem that's taking place in your patient and be able to have the tools to be able to correct it and create phenomenal results that really people from all over will travel to your office because they can't get it anywhere else. So it's a very, very dynamic approach. Also, the model today in the health field is that people are looking for you to be that one-stop office. They're looking for you to solve their problem. They're looking for you to find a system because they're kind of fed up on a lot of the other approaches and systems out there that are not really addressing and then correcting the underlying cause of their imbalance. You will have the ability, again, no matter what technique or procedure, we're not asking you to change your model of office procedure. We encourage you if you feel comfortable with it, but by learning TS diagnosis and these assessment tools and what we call visceral manipulation with nutritional support, you will be the leader You will be the stand-up guy or woman in your community, doctor, that will have the tools to be able to really deal with whatever walks in through your door. Temporal sphenoidal diagnosis is a new approach to the age-old question of how can I better help suffering humanity. This information is based upon the palpatory exploration of the skull side plate bones, which tell the doctor or the practitioner by exact location and measurement and a proven charted area which vital function of the body is in trouble. And I'm just going to tune into that. So the TS points, or what we're talking about here on the skull, are these points around the side plate bone that run along the zygomatic arch to the orbital area and around the sphenoid area, temporal sphenoidal area, and then it drops down along the side plate where it goes to the ear, and there's a point in the back. These are all, and we'll talk a little bit about the landmarks. This is what Doc was talking about. This is what Desjardins first began to research. The temporal sphenoidal ring is a kind of master control panel. It's a circuit breaker box for all vital functions in the human body. So think about that. It's a circuit breaker box. So you know what happens when a circuit breaker goes off. Why does it go off? It goes off because there's a surge, or there's an imbalance, or there's not enough energy or electricity that causes that box to go off, really in response to saying there's a problem going on somewhere. So I'm going to shut off, or I'm going to overactivate. A troubled viscus anywhere in the body, meaning that a problem with a vital organ or tissue anywhere in the body will flash its distress signal to the brain through this control panel. So any viscus that's in trouble, as it communicates with the brain, will cause this circuit box along the side plate bones of the skull to go off. And you, as a practitioner, have the ability to assess it in a matter of seconds to know where that's coming from and what it relates to and how you can fix it. This panel, in turn, is directed through brain control to send more life force to the distressed area, meaning that when there is an organ in trouble or a viscus or a vital area in the body, it's going to send a message here and ask the brain to send out more innate power or healing energy to that area in the body that's in trouble. And so it's really a defensive mechanism. It's really something that begins to talk to us to say, you know what, help me. I'm going to show you something that's going off, and just find it. And there is a way to find it, and there's a way to fix it. The temporal sphenoidal ring is a sort of a logistics center of supply and demand, which your palpating fingers can intercept and interpret as vital function problems. Can you see, says Dr. Reese, can you see the fantastic ability of the temporal sphenoidal ring diagnosis to tell you which part of the body is in trouble? Diagnosis that is available at any time, he says, you wish to look for it. So you could absolutely assess this on every patient coming into your office or client, no matter what practitioner type you are, what healing discipline you use, and implement this system to look at this circuit box at any time you wish to look to see if there's some area of the body is in trouble. This is a truly spot diagnosis to record the very living pattern of cause and effect, of supply and demand, of living forces in any one human body. Doc says that he observes an interesting change that occurred before and after an adjustment that he received in the external auditory meatus in the inner ear. This observation discovery was in 1963 at the Aladdin Hotel in Kansas City, Missouri, at the annual Sacral Occipital Technique Clinic. Preliminary physical examination brought out the fact that a tortuous external auditory canal was found. After an SOT adjustment, sacral-occipital technique adjustment, this canal became normal. So what Dr. Reese began to figure out was the fact that the temporal bone was in some way connected to what was going on in the body. And that's how his research began. This observation was the green light to go ahead with temporal sphenoidal research to find out why, where, and what did it mean. With this temporal sphenoidal research, he was on the very crux to use TS technique in its ability to evaluate human disease. So, this is what the 3 Days with the Masters program is. One of the things that Doc, in his electrical background, began to research was that there are hundreds of different patterns of brain waves that occur in brain function. The largest and easiest brain wave that can be evaluated and looked at on an oscilloscope, this is going back many years, is what's called the alpha wave. Now, for those that don't know or that are listening in, this alpha wave is the wave or the part of the brain, as we know that when we're relaxed and we're getting ready to fall off to sleep, it's that relaxed state prior to falling off to sleep. Well, the alpha wave or that alpha state is also the state that is the healing wave. The wave that we activate when we go into what's called rapid eye movement sleep state, which we should go into about 4 to 5 times a night. Unfortunately, as we all know, most of America does not sleep properly, and no one is waking up in the morning refreshed and renewed and reconnected, ready to charge out there. With TS work or TS evaluation in this rapid assessment, we also have the ability to be the director to redirect this alpha healing wave to resuscitate that vital organ in the body. Now, as chiropractors, those that are listening in tonight that are chiropractors, we all knew that we went into the profession because we believed that there was an innate healing power. The power that takes 2 cells and make a human being out of it. The power that directs those cells to heal when we cut ourselves. The power that tells your stomach to digest the food you eat in the morning. The power that keeps your heart beating without you directing it. That healing power always wants to express itself at 100%. The problem is that healing power, the direction of it, can be lost, meaning that the pathway to heal and shunt this vital healing force can be missing, not directed, and we have to redirect it. The innate force or the innate power of the body has absolutely the ability to heal anything as long as it's redirected properly. Now, the thing is, though, as a practitioner learning this system of TS diagnosis, visceral manipulation, and applied nutrition, this innate power does not have the ability to be able to mechanically move something back in place due to the stresses of gravity in our environment. What I'm trying to say is that anything can be redirected with this healing power, this innate alpha force, to resuscitate any part of the body that's in trouble. But it doesn't necessarily have the ability to take something that's fixed or stuck and unstuck it, if I can use that language, and put it back where it belongs. That's what you as a practitioner is going to learn in this system that you can do very skillfully and very specifically through these visceral and soft tissue techniques and corrective procedures that you will learn. They're not difficult. They can be easily learned and then eventually mastered and implemented, as I said, into whatever system or technique you're currently using in your practice. So, let's talk a little bit about and demonstrate a little bit. I'll stop talking so much. Let's just go back over the TS. Again, there are landmarks that you will learn when you take the course that we get into very specifically And we do a lot of, we believe in practice. Practice, 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 practice. So when you take the course in these 3 programs, you're going to have a lot of practice time. We're going to give you the information, and then we're going to watch you do it, and we're going to help you learn how to do it so that you really become the master of it and you own it. So the TS line, again, as I said, begins in front of the external auditory meatus. It runs across the top of the zygomatic bone, goes up the bone that constructs the orbit of the eye. There's a landmark here, which is a little indented area. We get into the specifics of it. We go along the sphenoid bone, we drop off along the temporal and back towards the external auditory meatus, and in back at a landmark where the occipital mastoid suture comes together, there's a reflex there called, or an area called the asterion. That's part of the cranial makeup. And right in front of that asterion is another reflex. Now, along that side plate, along the zygomatic arch, in front of that external auditory meatus, Dr. Reese found that there was a reflex that relates to the kidney. Now, what happens is that when there is an organ or a viscus in trouble, as I mentioned, this side plate bone is a circuit breaker board. And the tissue or the coverings along the temporal bone activate by becoming nodulated or swollen or tender. Why does the body do that? It does that because it increases the amplitude or the brainwave output to try and help that organ that's in trouble. So what Dr. Reese, is that he correlated points on the abdomen, on the front of the body primarily, that he called skin talk areas initially, or Dr. DeJarnett did. Dr. Reese renamed it and he called them entrance points. Every vital organ of the body has an entrance point that has a hookup that Dr. Reese figured out that related to a specific region or point along the side plate temporal bone. It's really masterful. It's ingenious. So what happens is that these entrance points or skin talk areas that he figured that relate to each viscus become sensitive and tender in a way of having a direct circuitry to the associated point on the skull that becomes sensitive and ouchy. So if you palpate these reflexes with an index finger, which we teach in the course, and there's other ways we're going to demonstrate to do that, you will find there's a way of finding the most tender point that immediately points to the entrance point that's in trouble, the organ that's in trouble, and the relationship of its spinal relationship. Now, those who are listening in tonight that are chiropractors or in chiropractic school understand that there's a structure governs function, which means that we know that the neurological functions or the nervous system has a direct relationship to vital organ, glandular and tissue function. But one of the things that we have to begin to look at more is the understanding of the visceral somatic relationship to the spine. Because most spinal disruptions or subluxation patterns are not originating from the spine in the first place. They are coming from a viscus or a vital organ, tissue, or area of the body that's in trouble. So it's not just a question of making an adjustment or manipulative procedure to make the correction, because invariably it's going to come back unless the origin of the problem is corrected. And many times it is coming from the viscus or the vital organ that's in trouble. Okay, so along the side plate bones of the skull are reflexes that become ouchy or tender. The first point we call TS12, 11, 10. So from this side area, kidney, small intestine, adrenal, liver, ileocecal valve, cecum, ovary testicle, colon, uterine prostate, coronary system, myocardium, lung, gallbladder, bile duct, stomach motility means that you can evaluate this point and determine if someone has a diaphragmatic problem, what we call a pseudohiatal hernia. 5A is the secretions of the stomach, HCl deficiency, pH problem, and so forth. 6B, pancreatic enzyme problem. 6A, pancreatic insulin. And 7, at that asterion point that I mentioned, is spleen, lymph, and blood. So right there at your fingertips, in a matter of a minute, you can immediately evaluate what viscous and vital organ's in trouble. Now, and again, I'll demonstrate in a few minutes. So, let's do it now. One of the things that Dr. Desjarnais always did in his seminars, and especially as he wrote his manuals, he would always have a research section of his SOT manual, Sacral-Occipital Technique Manual, that he called New Research. And one of the things that Dr. Desjarnais was doing over the years is he was experimenting in what he called mind language, something that Dr. Rees did for many, many, many years. The ability to be able to communicate with the mind or the consciousness or the subconsciousness of the patient or the person that he was working on or being tested. One of the things that Doc did is that he began to investigate the relationship of motor and sensory innervation as it related to the homuncular nucleus in the brain. The ability of the brain to communicate, again, with the body. And the thing that Doc always said is that the mind, or the subconscious mind, was the greatest doctor and physician in the whole world. It records every scrap of information that has ever taken place. Since most of motor and sensory innervation from the brain or from the homuncular nucleus ties into the right arm, that we can use, or Desjarnais found also, that we can use the right arm to access information as to what's going on with the patient through the neurological functions of the brain and also through the proprioceptor system of the body. And which is kind of the proprioceptor, to keep it simple, is like the telephone lines to the brain. And what Doc always said was that the brain has kind of its 24-hour repair and maintenance crews, always on call. And as long as the repair crews are on call and all those lines of communication are hooked up, the body's happy. What happens, though, is that proprioceptors can turn off or shut down so that the brain or the repair crews can't send out or look at an area and see that there's a problem there. When you use right arm, what we call mind language testing, you have the ability to be able to assess what's going on with every component aspect of your patient. Now, those again that are listening in tonight that are acupuncturists or chiropractors or kinesiologists or whatever, there's a lot of misconceptions and misunderstandings as it relates to muscle testing. And being involved and around the profession now for almost 40 years, and being mentored and having as a good friend of mine, Dr. George Goodhart, the founder of Applied Kinesiology, we may, I'm just asking all of us to keep an open mind and begin to experiment and understand that the pioneers that made this profession are people that investigated these things and utilized it as an adjunct in their practice. Also, Dr. Rees was also a diplomate in orthopedics, a postgraduate course in our profession. And he believed that the ability to use the right arm was a very highly sophisticated orthopedic test. We don't just utilize this mode as the primary mode of testing, but we use all of our other skills to assess what are other indicators, whether that's blood testing or whether it's functional medicine testing and it's palpation and x-ray and all the other things that we want to use to evaluate our patients and our clients coming in, as well as our ability to utilize these other tests so that we can put it all together and really assess what's going on with the patient. So let's show you how it looks. And so I'm going to have Kristen come on up. And Do I need to move this back, Rich? Okay. Do we miss a circuit there? Or we're okay? Okay, so what we begin to learn, so let's just show you what it looks on a live specimen. So Doc always evaluated the right temporal sphenoidal area. So here was the zygomatic arch and up, along, back, and it drops off back, and then the asterion is back here. So let me just show you again. 12, 11, 10, 9, 8, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5B, 5A, and these are all very specific points. And the left side of the skull, temporal, parallels the right side. It's kind of a mirror image of it. Now, when we teach you this rapid assessment, understand that each one of these points that relates to a vital organ, viscous, of course, that has a spinal, also what we call a spinal major relationship as well. Now, there's several ways that Doc used to do this, and the way in which we teach in the course, and which will demonstrate all of them. But for a rapid assessment, we're going to use a right arm mind language muscle test response. Hold strong. Now, the doctor has a choice, and what we teach in the course, in the first one, is that we can do a quick rapid assessment of the groups of the TS point. There's 5 major groups. The first group along the zygomatic arch, now I don't know what Kristen has, we'll see if she has something tonight. So, is we're going to take our fingertips and we're going to touch along the bone, the zygomatic, for section number 1. And we're going to assess the arm to see if it remains strong, which will be our no response, meaning that the body is not active, or if there was an active reflex, the arm would drop and go weak. So we'll test those points, and Kristen is fine there. So immediately, in a matter of seconds, we know that there is no major organ that's crying out for help as it relates to kidney, small intestine, adrenal, and liver. The next section is L1, 2, 3, 4, 5. Section 2, as we call this in the course. And we just do an overall screen, and Kristen is fine there. So we move on to section 3. Section 3 is the coronary system, the myocardium of the heart, psoas muscle, diaphragm, lung, bile duct. And we go to that point. And she tests nice and strong. So now we go into section 4. There's 5 sections. Section 4 is stomach. Again, motility, stomach secretion, pancreatic enzyme, pancreatic insulin. And we just touch along, and you notice her arm goes down. So that means that in one of those points, or maybe more than one, there can be more than one point, that there is an active temporal sphenoidal point that is activating in response to the viscous that it relates to, saying, I need some help. And I'll go back here in a minute. Let's just check the 5th section, which is TS7, relates to spleen, blood, and lymph. And she's fine. So, in the course that we teach, when the doctor learns this, we then want to, once we find the group of involvement, we're then going to isolate and find which point it is. Now, 5B is the first point we're going to check, and that relates to the diaphragm, pseudohyoid, and the rib cage, and that is not it. So she tests strong. So I'm just isolating those 4 points, which went weak before. 5A is the secretions of the stomach, and she tests. So it's not the stomach. We go down to 6B, which is the enzymatic functions of pancreas, and it's not that, and we're going to go to 6A, and the arm drops. So we know that we have an pancreatic insulin involvement. That means that, and that relates to thoracic 6 of the spine. So in the course, we learn how to assess that spinal level. and correct it. And then we're also going to evaluate the need to perform visceral manipulation. In the course also we have indicators, I'm not going to show that tonight, of how we assess the need for the body to supply the proper nutritional support for it as well. So 6A, then we can come in if we want, and we can palpate that point, and it's very tender on 5 pounds palpatory. I can go to 6B. She doesn't ouch on that. I won't poke her there again. Just to show you, I can go to the 5 points, and there's nothing there. So, again, this has led you, the practitioner, very rapidly to be able to immediately assess the viscous that's calling for support and correction, the related level of the spine that it relates to, and the need to perform visceral manipulation. Now we have a specific indicator. I will show it tonight. In our system, we've developed over many years specific reflexes that can isolate and determine whether or not we need to perform that visceral work on the patient, in this case Kristen. And that point is right there. Now, if her arm stays strong, which it doesn't, it means that the need for visceral work is not indicated. We also have a very specific nutritional indicator. So a lot of doctors tell me as I teach around the United States, they don't really understand when, other than they using blood work and blood testing, but they would like an indicator that definitively tells them when nutrition is indicated. This is it, right there. So no matter what, if this test does not weaken or to stay strong, now you notice she stays nice and strong. So really, on this session, this visit, the patient does not need nutritional support. It's not indicated. It needs visceral. There's something that needs to move that's not moving. Okay, so let's demonstrate and show you what that looks like. Lie on your back. Okay. So, when we perform visceral manipulation, anyone that's doing any type of soft tissue work or work with organs, one of the major factors that Dr. Reese and even Dr. Desjardins said that most imbalances or problems that happen in a vital organ or a tissue of the body occur due to what we call liver portal circulation back pressure, which means that the liver gets swelled and overloaded really due to the bile duct, the common bile duct, from stress and internal stress shutting down and not allowing the liver to empty its contents. So what happens is that the liver back pressure, the shutting down of the bile duct, not allowing the liver to drain, creates portal circulation back pressure and affects some other vital organ of the body. Now, common areas from liver back pressure are the spleen, the gut, and the lymphatic area, really. But those are common. Stomach, spleen, digestive function. Now, in the work that you'll be learning, there are reflexes that become tender, a map. The body is a road map. One of those reflexes is the bile duct, which is the thumb web. And we check that first, and it's tender, so there's inner stress. So you, as the visceral or the bloodless surgery, visceral manipulation physician, is going to learn how to relax that. And there's techniques that you'll learn in the course that can relax that, and you can notice Kristen's breathing immediately changes as we relax the common bile duct. In our so this procedure of relaxing the bile duct and draining the liver precedes any practitioner who is doing visceral work, has to be done first. because you have to take the liver back pressure off before you work on the other organ. So we relax that and we can go back and check our point, and it's clear. There's no reflex there now at all. And in the course we'll teach specific reflexes for each vital organ and how to perform that particular technique and procedure. The liver has a reflex at the third rib space for the front of it and for the back of it. It's a little more tender in the back. So again, we teach that there's specific techniques and procedures that we teach of how to do what we call a liver pump or a liver drain, which I'll demonstrate here. So when we drain the liver, I'm getting the anterior and then the posterior. And that drains the liver. So now we can determine where that back pressure. Now we already know, and we can recheck the indicator. It feels a lot better. Now the pancreas, every organ has its own reflex, and the pancreas, which was their primary on the TS point, has 3 sections to it. The ones close, that become tender. This is the tail part of the pancreas, where the islets of Langerhans that secrete insulin. This is the body part, and this is the head. So her tail was a little tender there. Now, the practitioner that learns visceral work will be able to, when we train you, to be able to feel where that restriction was. Or I shouldn't say was, is. And it's right in there. And what happens is that when this portal circulation back pressure, there is an organ, and that creates a swelling, and restriction creates adhesions. Inability of the organ to move. And remember, motion is life, non-motion is death. So the visceral manipulation practitioner will learn, which we teach, of how to feel where that adhesion is, which is right there. So when we teach you this, and you become sensitive and trained, you'll be able to perform different visceral techniques. Now, I'm just going to do what we call a dynamic stretch and just release the tissue. See, when you perform visceral work, and you go into the tissue, the body automatically, innately defends against it and pulls the tissue back, and we want to assist that. There's a little here, and we just want to and go back and check our indicator, which feels a lot better. Now, I mentioned before, I'm just going to demonstrate this as we get closer to the completion of the show, and I mentioned that we now want to retrain or redirect the alpha wave energy, the healing wave, to be able to shunt it, to retrain and help that entrance point, that lost pathway, so that that healing energy can now resuscitate, and then there's techniques that we do to teach the patient or the client how to do this at home. So you'll learn this in the third class, or the second and third class of the 3 days with the Master's Program. Now the entrance point for the pancreas is twofold. Usually the one that's most associated with the islets or the tail of the pancreas is in this area here. Right in this lower, and it becomes very tender, some very ticklish. There's also one on this side here. And I don't really feel that one there. So this is going to be this is the entrance point that is not receiving that alpha wave, healing wave, to continue the job of resuscitating and bringing that vital organ back to health. You have the ability to be able to be the lifesaver. You can bring that organ that's in trouble back. as you learn these procedures and follow through and follow the system in the way in which we teach you these assessment tools to really create some phenomenal, miraculous changes in your patients. People walking into your office, people, have these problems. They're in trouble. They're in degeneration. They're breaking down. And again, you have the ability to help them. You have the tools by the end of this 3-day program, and then if you further advance, but just in the 3-day program alone, you have the ability to learn these skills to create phenomenal changes dramatically, not in 30 sessions or whatever, very rapidly. And to also to empower your patients, which then they help to empower you in growing and helping you to grow your practice and your business and help more people, because that's what this is all about. So I'm going to show you what the alpha wave looks like. Now remember, as I mentioned earlier, the alpha wave is the healing wave of healing, the relaxing wave right before we fall off to sleep. It's the REM state. You know, again, I mentioned we should have proper REM sleep of 4 to 5 times a night so that we wake up in the morning recharged and ready to go. Something that most people do not have. Now, when we perform alpha wave, we're going to go back. If you remember, the active TS circuit was 6A, right close here. That became very tender when I poked on it. And also as we use mind language testing, weakened. So as you learn alpha wave, we're going to use our index finger, and we're going to contact that point. And my body, as the practitioner, acts as a biological shunt, and with my fingertips of my right hand, I'm going to go to the entrance point, and I'm going to lightly just touch it there. So now I've created a circuitry to shunt the alpha wave using my body as a biological shunt and direct it into that entrance point so the body will receive it and begin to resuscitate it as we're training that lost pathway. Remember, the brain has lost the ability and the mind to shunt that healing energy to that entrance point. So, when we do this, we lightly touch with our index on the active TS circuit at the entrance point, and we instruct the patient that we want them to close their eyes and look up as if they're looking right to the center of their forehead. Now, when a person does that, you're going to see your client or patient, they'll go into rapid eye movement. Their eyes will start fluttering, and we want that. That's a good thing. So we're going to contact and ask Kristen to do that. Now what happens as you begin and learn this, you as the practitioner will absolutely feel this flow, and you see, and Kristen's breathing changes. That's a release. We're redirecting the pathway as being opened. And the doctor, practitioner, as I was mentioning, becomes very warm, and they feel the heat. Now, once it's activated, we teach the practitioner that they can stay here for no more, for just 2 minutes, we want to hold this, or you can take your hands away and leave the patient there and leave the room for 2 minutes, leave the patient and come back in 2 minutes, and it's complete. Now, a lot of patients, because you're activating REM, not only do they feel phenomenal when they get off the table, but they won't want to get up. They're so relaxed. And they really feel that something has taken place, that they're healing. And there's techniques and procedures that we teach in the course that you will train your patient how to do this at home to continue to facilitate the process. So that's what it looks like. So Kristen doesn't want to get up off the table right now. She's pretty relaxed. So let's go back and check that point again. You okay?
Yep.
Good. So if you remember, that TS point, 6A, was very tender on Kristen. And I can poke on that pretty hard. And there's really not much left there right at the moment. Now, when I screen and go back to that area, this test nice and strong. and the patient would be done for today. Now again, if you are a practitioner that does spinal adjustments or manipulation, you will certainly also evaluate that spinal level, and whatever procedures you use or techniques, you can certainly correct that and work with that, which is discussed again in the 3-day program. You can sit.
Thank you.
So that's kind of what it looks like. So again, it's a very, very rapid, again, assessment and a system that can immediately identify, number one, what organ is your priority in trouble, what needs help, whether or not there's indeed nutritional support that's needed, the spinal level that it relates to, and what needs attention as well. But many times you'll find that those who are listening in are practitioners that take the course that are not trained, or their license does not permit manipulation. Many times the spinal problem clears because the spinal imbalance or the structural imbalance is really, again, as I mentioned, a visceral somatic problem is coming from a vital organ or a tissue of the body. So that when you clear that out, you go back to the spine and it's not there anymore. It goes away. And it's pretty dynamic. So that's kind of what it looks like. And we go into depth on many, many things. And as I mentioned, in the 3-day program, there's a lot of practice time. Because unless you practice it, then it's very difficult to go back to your practice on Monday morning and begin to utilize it. So again, we're not asking you to change your technique or procedure. But I know that as I talk to doctors and practitioners around the United States, the aspect of time, ability to assess the underlying problem is a concern that many, and plus patient outcome, to get the results. Many people that are insurance-based practitioners and worry about that, there is no need to worry about insurance. People will happily pay for your services because you are providing them an incredible system that really helps them to achieve optimal balance again and get well. So here's what's available for you. The next 3-day with a master's program will begin on the weekend of April 4th. The course is taught, again, as I mentioned, in a 1-day class, beginning at 8:30 and ending at 5:30. The first class will be in the Seattle area by SeaTac Airport. And then Sunday, the course is taught again in Vancouver, Washington. All of this information is on the Biotics Research Northwest website. So www.bioticsresearchnorthwest.com. You can find all of this information about the course and register for it. I will also mention that anyone that's listening in tonight, if you go to Biotics Research Northwest and register for this class, there is a discounted savings that will be applied for you to take this program, and they have all that information. All you need to do is to mention to the individuals there at Biotics that you heard this show and mentioned 3 days. The code is 3 days, and that's all you have to do, and they'll help you out with that. Again, it's a phenomenal program. It's really not being taught to this depth, really, in the United States and internationally. You have the opportunity to raise the bar in whatever field of profession you're in, the ability to rapidly assess and determine what's going on with your patient, and to really love what you do every day and really uplift and help humanity in the techniques and procedures that you do in your practice. Also, we are available. I'm available for any comments or questions. You can email me at Davis, D-A-V-I-S. I'll give you two email addresses, Davis Mystic, D-A-V-I-S, M-Y-S-T-I-C, at AOL, or info@davisahs.com. So Davis Mystic, M-I-S-T-I-C at AOL, or info@davisahs.com. And you can communicate with me or ask questions. I would encourage you to also go to our website and look at, we have a lot of great videos on there and information to check out. And so I appreciate you tuning in tonight, and hopefully you will, we'll see you in April at the 3 days program, and I think that's about it. So it's a lot of information for you to grasp. Look at this again. The show will be archived, right, Rich?
Yeah, absolutely.
Pretty rapidly.
There's two comments from Anne. Welcome back. I missed your new shows. Also, the techniques you showed tonight, can they be diagnostic of a condition that the patient may not be aware they have? It is very interesting.
Absolutely. You are pinpointing primarily underlying components that most people are not aware of that they have going on in them. And remember that these individuals that have a problem or an imbalance are not, but they may not have an outward pain or imbalance, but they don't feel like a 10 every day of their life. You know, there may be fatigue, there may be achiness, there may be... So the answer is yes. You are evaluating something that can also be pre-state prior to there being... See, I just want to say this in response to that question. When there is a need in this system to perform these bloodless surgery or visceral procedures and implement this alpha wave resuscitation technique, so to speak, that organ is in vital need of help. That is a severe state of imbalance of that vital system that needs help. Because something not only is there a functional problem that's going on at that level, but it can lead to a pathological state that may be going on in the body. So the answer is yes. You're absolutely evaluating something either in the mix of what's going on already or prior to that becoming symptomatic or a condition or an illness that may be developing. So it's a very good question. Okay, so by the way, I will be back again. We have a show next week, which will be similar. We may go into a little bit more. I will discuss some of the same concepts again. So those listening in who may know someone or other people that wanted to be but didn't have an opportunity other than listening to the archive shows, I will be back again next week with a live show discussing the same, our system in the 3 days with the Master's Program. So again, I'm going to sign off. It's been a pleasure to be here, and thank you for giving me the opportunity to share this wonderful work with you. And I'm going to sign off. Dr. Ken Davis, Creating Health, Mind, Body, and Spirit. And happy spring to all, and enjoy the weather as it gets better and better. So have a good night and a great week, and hopefully we'll see you at the course. Take care.
You've been listening to Creating Health, Mind, Body, and Spirit with Dr. Ken Davis. Please visit the davisahs.com website to find out more about the Davis Advanced Health System. That's it for Rockland World Radio. Visit the archives of Creating Health, Mind, Body, and Spirit. Until next week, this is Rockland World Radio.
It's not just radio, it's Rockland World Radio. RocklandWorldRadio.com